everyone, my name is Namadi Nunong. I am 4th year nursing student and today I will be examination a basic physical examination and today I will be demonstrating a basic physical examination for the community health nursing course at the Police Nursing College. I hope this demonstration will be clear and informative. Thank you. Good morning, ma'am.
Good morning.
My name is Patricia. I am 4th year nursing student. Could you please tell me your full name?
นางวิภาวันมารัตน์ค่ะ
Thank you, Mrs. Vipawan. Could you please tell me your date of birth?
5 พฤษภาคม 2512 ค่ะ
Thank you. Today I'm going to perform a head-to-toe physical examination. The examination will take about 20 to 30 minutes. During the examination, I will explain every step before I do it. If you feel any pain, discomfort, please let me know at any time. Your privacy will be maintained throughout the examination. May I have your permission to begin?
Yes.
Thank you. Do you know what the day is? Day.
6 กรกฎาคม 2569 ค่ะ
Alright, correct. Where are you now?
โรงพยาบาลค่ะ
Okay, correct. What are you doing here today?
มาตรวจสุขภาพค่ะ
Okay, next, may I take your blood pressure? Okay, put your arm in the table and have a temperature. Your blood pressure is normal. Your temperature is normal too. Okay, next I'm going to listen to your lungs. Please take a deep breath. Breathe out. Again, deep breath. Breathe out. Take a deep breath. Breathe out. Take a deep breath. Breathe out. Okay, your lung is normal. Next, I'm going to check your skin. Okay, put your hand on the table. Your skin is well hydrated. Evaluation is we will place on fingernail bed until it is blunt or white. Release and count time until pink returns. If it's normal, it is 2 seconds or less. If it's abnormal, it is more than 2 seconds. No cyanosis. A small diamond-shaped window is present between the nail beds, indicating no finger clubbing. Okay, next follow my hand movement like this. Finger, yeah, like this. No clubbing finger. In a healthy eye, the sclera is essentially white with only a few small blood vessels visible. There is an adequate tear film with no significant discharge or watering.
Brush strokes
There are no scalp lesion or dandruff. Next, let me check your eyes. No pale conjunctiva. Normal field of vision. The normal eye can detect stimuli over a 120-degree range vertically and a nearly 160-degree range horizontally. From the point of fixation, stimuli can typically be detected 60 degrees superior, 70 inferiorly, 60 initially, and 100 degrees temporally. Next, follow my finger with your eyes only. A normal pupillary light reflex means both of your pupils should instantly and equally constrict when a bright light is shown to either eye. In a healthy adult, pupils typically measure between 2 to 5 millimeters in standard lighting and rapidly narrow to protect the retina from bright light. Your eyes' reaction to light. Next, I will perform a test using Snellen chart. Please stand 6 meters away and cover your left eye and read the character I point to.
5 8 3 2 7 9 7 1 0 6
Visual acuity testing assesses central vision sharpness. A standard normal result is 20/20, indicating that you can resolve details at 20 feet as clearly as an individual with standard baseline vision.
6 7 1 1 3 8 4
Okay, thank you. Next, I will check your ears, checking the outer ear and looking for symmetry. I'm going to palpate the auricle to check for any lumps. Okay, it's normal, no any lumps. Next, I will use a flashlight to check for any discharge. Normal hearing acuity means you can comfortably hear sounds across all speech frequencies at volumes between 0 and 25 decibel. In a standard pure tone test, this indicates the softest sound you can detect at every pitch falls within this baseline range. Okay. A normal tuning fork exam consists of two tests. The Weber and Rene tests. Normal
Next is the
findings
tuning fork
indicate
test.
healthy middle
If
in
you
inner
hear
ear
the
function.
sound, please say,
Weber
I
test
hear it.
sound is heard equally in the middle of the head with no
ได้ยินค่ะ
lateralization.
Okay, next ได้ยินค่ะ ได้ยินค่ะ
Okay, next is examine the nose. I will checking its appearance, symmetry, and for any swelling. Then I will use a light to inspect the nasal mucosa and check for any noodles inside. Okay, no any nasal mucosa and no any noodles inside. A normal smelling test result means that your olfactory nerve, nasal cavity function, and the brain region responsible for processing smells are working properly. This indicates that you can receive odors, detect odor intensity, and identify specific types of smells according to medical standards. What smell?
ส้มค่ะ
Okay, correct. Normal assessment findings vocal quality. Speech is clear with no hoarseness. Nasal quality or breathy sound. Swallowing. The patient can swallow liquids and solids without coughing, choking, or experiencing a feeling of food getting stuck. Uvula and soft palate. When the patient say ah, the soft palate elevates symmetrically and the uvula remains in the exact midline. Gag reflex touching the posterior pharyngeal wall produces as symmetrical gag reflex. Cough. The patient can produce an explosive, sharp cough. Next, I will check your pre-auricular, post-auricular, and occipital node. Excuse me. Then I will check your tonsillar and submental and superficial cervical. And the last one is thyroid. A normal finding for cranial nerve 11 means there is no damage to the nerve pathways controlling your neck and shoulder movements. This indicates you have full strength, symmetry, and mobility in the muscles it supplies. Put my hand on your shoulders and next shock your shoulders against the resistance. Next, I will examine your cardiovascular system. I'm going to palpate at your vascular at neck, especially the carotid pulse. Next, I will palpate at the brachial pulse. And next, radial pulse. And next, femoral pulse. And next is popliteal pulse. And the last one is dorsalis pedis pulse. Next, I'd like to listen to your heart sounds and heartbeat.
Normal heart auscultation yields a clear, steady lub-dub rhythm with no murmurs, raps, or extra beats. This consists of a distinct S1 sound when atrioventricular valves close, followed by an S2 sound. When semilunar valves close, the sounds should be crisp and evenly spaced.
I'm going to palpate the position of your trachea. Excuse me. Next, I'm going to observe your chest expansion. Please breathe in and out. And now, please turn around. Breathe in. Okay, going to tap on your back to listen to your lung sounds.
Lung percussion is performed to evaluate the resonance of lung tissue. Under normal conditions, resonance is the primary sound elicited. This is a low-pitched, hollow sound similar to tapping on an empty box because healthy lung tissue is filled with air.
And next, I will examine your gastrointestinal and urinary system. Okay, I will use a stethoscope to listen your bowel sounds.
normal bowel sounds.
Next is abdominal percussion, used to access internal organs and detect the presence of fluid, gas, or masses within abdominal cavity.
Plum.
The result is timpani throughout. I will perform percussion of determine of the side of the river, moving downwards from the chest area until the sound change from resonant to dullness. In order to access the liver size, your liver measure is 7 centimeters, which is considered normal. Next, please lie on your side and rest your hand to in front of you. The result show a dull sound in second intercostal space, which is considered normal. Next, I will examine for ascites. Please place your hand on your abdomen here and hang it there. There is no ascites. Next, I will palpate your liver, kidney, spleen. Please let me know immediately if you feel any pain. Breathe in. Breathe out. Breathe in. Breathe out. Feel the 1 centimeter lumps, so the results are normal. Breathe in. Breathe out. Breathe in. Breathe out. Next is Murphy signs test to access for cholecystitis. Please take a deep breath and let me know if you feel any pain. Take a deep breath. change your arms, legs, and access your muscle strength. Next, please follow my instruction. This is an examination of the cervical spine. Okay. Next, I will test the thoracic and lumbar spine. Lean your body to the side. It's called lateral bending. Okay. Switch. Next is shoulder test. Twist your torso to the front and switch. Next, touch your hands together behind your back. Touch your hands together behind your back and your head. Bend forward and touch the floor with your hands. Next is the elbow test. Extend your arm forward, then bend it toward your body. This involves resisting force with your arms. Please extend your arms straight out. Next, I will test your wrist. Extend your wrist backward and touch your thumbs together and pull them apart. Now for finger resistance. Please extend your fingers and apply resistance against my pressure. Please try to squeeze my index and middle fingers with both hands. Next, try to spread your finger apart while I hold onto them. Next is finger test. Fully extend your finger, then spread them apart and bring them together.
เหยียดเต็มที่กางออกคุกเข่าขีดมือเอานิ้วโป้งแตะโคนนิ้วก้อยได้
Next, I will test your hip strength. Lie on your back and lift your legs one at a time against my resistance.
ข้างขึ้น
Okay. And do the same.
ที่ข้างนี้
Okay. Okay. And next, bend your knees and I will move your knees to your chest.
งอเข้าสองข้างโอเคพาไป
Okay. Lie your side facing away from me and push your legs as far as possible.
ทำเองมา
Next is a test of spinal nerve function. Please lift your legs one at a time. Okay. Switch. Okay. Finally, spread your legs apart It's called abduction กางเข้า and adduction กางเข้า Okay. Next is the test for ankle and foot movement. Extension. ทำช้าๆ dorsiflexion, plantar flexion, inversion, eversion, and abduction. Next, I will perform a neurological examination. One is finger to nose test. Okay. Next is heel to chin test. Next is I will test your biceps reflex. Give me your hands. Like this. Next is I will test your knee jerk reflex. Okay.
เดี๋ยวไปข้างนี้ก่อน
Next is Babinski response. Okay. Okay. ต่อไป pain นะคะ